Good afternoon. This is Desiree Duvall, founder of An Empowered Woman, and I have the pleasure of speaking with our partner, Dr. Edward Terino. How are you doing today?
Gee, I'm doing great, Desiree, and I'm so glad to be helping you and being your partner in this wonderful business that you've created.
Well, we're delighted as well because you are a wealth of knowledge and wealth of inspiration. So many times people talk about the fact that you are a plastic surgeon, a medical degree. What difference does that make in what you're doing as far as cosmetic surgery and all the procedures that are available?
Well, to be an authentic plastic surgeon, which goes back a couple of centuries and covers experience through the world wars, you have to have a general surgery training first of 5 years at least on every part of the body. And then there's a test you take, a board examination to get a certificate proving that. Then you go on to several more years in plastic surgery. And then you have to take another exam by the American Board of Plastic Surgery to prove that you know exactly what you're talking about and that you sound like you are competent. Now, that only is actually, believe it or not, 6,000 plastic surgeons in the United States have ever done that training. Now, the difference is that the other 200,000 or more doctors who call themselves cosmetic surgeons come from various other specialties, not even specialties. Some of them are just family practitioners, some of them are dermatologists, some of them are gynecologists, some of them are general surgeons. And those folks learn by videos or reading books. And there's a couple of organizations that are not the same as the American Society for Plastic Surgery or the American Society for Aesthetic Plastic Surgery that they belong to. But the problem is that those people without that training and without the experience of the authentic plastic surgeons, there's a higher chance of not a good result or even complications. So for the American public, I always tell the patients, the most important thing that you need to do is to choose and evaluate your plastic surgeon very carefully and even get referrals from patients saying that they've had testimonials, I should say, that show that he does good work. That's the most important thing.
Well, that's really huge because I bet 90% or a large percentage of the people, when they have these surgeries done, do not know that differentiation, do not know that there's a difference. And I'm sure that has an effect on the results that they may experience. And it's not so much the procedure itself, but it's also the different complications that may come, underlying complications that the average person, if they don't have that experience, won't know how to address or won't notice them to be able to address the other concerns.
And the thing that amazes me is that patients come to me all the time, and a lot of times they're very sophisticated, educated people, well off economically. And the first question I ask them is, how do you know about me? And they say, well, I heard about you, or a friend of mine told me about you. And I said, well, did you look up my training or anything about me? And they say, well, gee, no, I didn't. And I said, well, you darn well should go home and do that.
Well, it's back to the saying that people don't know what they don't know. And again, they're usually so excited and so passionate about having whatever they want done that they don't do the due diligence. So thank you so much for making sure that you are that exception, one of the few exceptions that actually have that training. I want to encourage everybody who's even interested in having anything done to take advantage of your complimentary consultation. I know you offer the in-office consultations and even virtual if somebody's out of the area. So there's no excuse for not interviewing your doctors or whatever they decide. They should be interviewing them and finding out what their true credentials are and verifying it as well.
Absolutely. 100%,
Great.
100% agreement.
Thank you. Well, I thank you so much for sharing that with us because, again, we don't know what we don't know. And until we meet again, stay empowered.
Thank you.
Good afternoon. I'm Desiree Duvall, founder of An Empowered Woman. And today I have the pleasure of speaking with one of our partners, Dr. Edward Terino. How are you doing today?
Gee, I'm doing great, Desiree. Part of the reason is because I'm helping you and your wonderful cause, and it's fun to work with you.
Well, thank you. And I just so appreciate you sharing this knowledge about, plastic surgery, cosmetic surgery, and now we're talking about non-invasive surgery and cosmetic surgery. What is it and what is it not? Because this goes around so freely. Fill us in.
Well, the cosmetic surgery industry is so unbelievably enormous these days that you can't not see something on television and magazines all the time. And it's all about beauty and all sorts of ways that you supposedly can do it with creams and various techniques that do not necessarily interfere with your life. And that's what the American public, the busy, busy public here in Southern California and everywhere else, are looking for. So the surgery, invasive surgery that we do and we're brought up to do is a wonderful thing. It has great results. It does cost a fair amount of money, and it certainly takes you away from your work for at least a week and maybe two. And not only that, but a lot of people are very afraid of surgery, of course, and anesthesia. So the dermatologists and some of the plastic surgeons and the estheticians have developed these non-invasive uh, techniques that are done in stages, so they're affordable. You might need, most of them need at least 3 treatments, and the treatments are maybe in the range of a little over or a little under $1,000, and they make changes. The changes are, however, and this is the most important thing, they're not permanent, they're temporary, and I can't really tell you exactly for how long they last because they're all lasted to a different degree. Some of them are only a few weeks, some a few months. Not many of them are more than a year or two, and maybe not even that. So, but they are inexpensive and they don't take you away from your work. Maybe a day or two, you might get a little red, you might get a little swollen. They're usually not very painful to have them done. They could consist of things like laser treatments to your skin for wrinkles and sun damage, radio frequency treatments to your skin or your neck to tighten up the skin and shrink it and make it look better. Also, there's very hot pack type of machines and the cool sculpt, which is a freezing of the skin and the fat mostly underneath the chin. And those things destroy the fat and they help with the contour of the neck. There's even an injectable solution that Kybella that is injected into the neck also to shrink the fat. They all have some effectiveness and they attract the public tremendously. And the only warning sign I'm giving people is, and I have started to do them because the public is demanding them. They would prefer to try that over surgery. A lot of people I see that have had this done for years by other doctors kind of get frustrated by the fact that now they would prefer to have something more permanent. And of course, the problem is if you persist, and then we have also, excuse me, the injectable fillers and the Botox to give your face more volume and shape. But I use permanent implants of my own design that are also minimally invasive and they don't keep you out of work long. They don't take long to get over with. But it is an operation. It does cost some money. So the patient has to pay their money and take their choice. But they have to remember that if they keep using these other treatments for 20 years, they're going to be 20 years older and their body is going to look a lot older despite these treatments because they are temporary. And then they may not be in medical shape or financial shape even to have a permanent surgery or may still not want to. So that's kind of the story, but it is now a big and in fashion thing to have these treatments, and I'm doing them because it's become an essential part of the armamentarium, the toolkit of a real plastic surgeon. So that's
You know, well, you see it, as you mentioned, you see it everywhere. And it seems like, though, in the long run, they would have, by continually doing them, they would have paid for it if they had it the same amount if they had it done permanently over the period of time, over 10 years or 5 years. I'm sure they would have paid for the permanent solution. Permanent solution.
well, I
So,
need to interrupt you there.
yeah.
Actually, if they do these minimally invasive treatments for 20 years, and if they had a good plastic surgeon and paid $25,000 or whatever it costs to have a good facelift that would last 15 to 20 years, they're paying 30 to 40% more to have these minimally invasive treatments over the long run. It's just that it's more convenient, obviously, to pay small amounts of money as they go.
Sure, sure.
But we do have finance programs now that help people with the large number for the big plastic surgery.
Fantastic. Well, especially if it's something that they know they don't like, and they will never really, they've always want their chins or their jawbones or whatever the correction is. They'd always want that to be done. It's better to have it done permanently. That way they can enjoy the benefits for the rest of their life, as opposed to constantly being able to maintain it. So maintenance.
That's exactly right.
And by you being a certified plastic surgeon, be the perfect person to do it. Yes?
Obviously.
Well, I want to encourage. Well,
I want to help you and your clients.
Absolutely. And a lot of women, men and women, but a lot of our ladies are looking for options. And I always want to be able to present to them something that I know that has years of experience and has lots of recommendations, and that is actually certified and board certified as a plastic surgeon. So I encourage everyone to have a complimentary consultation with you. If they have any questions about anything, anywhere on their body, that they should come and have a consultation with you in person, or you also offer them virtually if they're out of the area.
That's true. But one thing I want to add is that we have now about 40% of my practice, and probably a lot of other people's practice, happens to be men.
Great.
And,
Great.
and they come to me mostly because they want the square jaw look and the square face look. And I can do that with my facial implants better than I can with fillers.
Fantastic. Okay, so men and women. Women, bring your husbands or your partners or your sons and whatever one, and everybody can come and see you for that consultation, and then be able to find out if it's a fit for them and take it from there. Yes?
Yes, yes, yes.
All right. Well, thank you so much for your time. I appreciate it, and we appreciate you. And I want to thank our audience for joining us today. And until we meet again, stay empowered.